Welcome back to today's Explainer. If you're on day 2 of your Pharmacy Tech Certification Mastery Plan, well, you are in exactly the right place. Today, we're equipping you with the critical knowledge you need to totally master order entry and, most importantly, patient safety. We're going to take a really close look at dosage forms, routes of administration, and frequency. I'm going to walk you through these concepts step by step because, look, mastering this material isn't just about passing the PTCE, it's about making absolutely sure your patients receive accurate, safe care. So, let's jump right in. Here's a quick roadmap for today's Explainer. We'll start with the what, looking at common dosage forms, then some golden safety rules. Next, the how, which covers routes of administration, followed by how we bypass first-pass metabolism, and finally, the when, where we'll decode prescription frequencies.
All right, kicking things off with Section 1, the what. We are looking at common dosage forms to understand the physical form of the medication.
Let's look at the most common forms you're going to see every single day. Oral solid forms, like tablets, might be scored. That just means they have a little line pressed down the middle so they can be safely split in half. Capsules, on the other hand, usually not meant to be opened or split at all. Chewables are, well, exactly what they sound like, super helpful for pediatric or geriatric patients who might have trouble swallowing. Then we've got our liquids, and the key distinction here is between suspensions and solutions. Solutions are clear liquids where the drug is completely 100% dissolved, but oral suspensions, they contain particles that settle right at the bottom. Think about it. If the patient doesn't shake that bottle, they're getting basically just flavored water on day 1 and a massive, terribly bitter dose of the actual drug on day 10. A great real-world example is azithromycin. It's often dispensed as a dry powder, so it requires reconstitution, which just means mixing it with purified water before you hand it over. And you've got to always include a shake well reminder for the patient. Moving right along to Section 2, the golden safety rules. These are crucial facts to protect your patients and help you ace the PTCE.
Pay really close attention to this one, guys. You must never crush enteric-coated or extended-release medications. Why? Well, medications like pantoprazole have an enteric coating specifically designed to protect the drug from being completely destroyed by stomach acid. If you crush it, boom, that protective barrier is gone. Similarly, extended-release meds like metformin ER are engineered to release medications slowly over a long period of time. Crushing them destroys that controlled release mechanism entirely. And that leads to a really dangerous situation called dose dumping, where the patient gets hit with the entire day's dose all at once, heavily increasing the risk of severe, sometimes life-threatening adverse effects.
Okay, Section 3, the how. Let's talk about routes of administration and how the medication actually enters the body.
In the pharmacy, we deal with a huge variety of routes, and the route of administration dictates exactly how fast and how completely a drug works. You have oral, or PO, which is definitely the most common. You've got topical creams and ointments for local skin conditions, and then you have transdermal patches, think fentanyl or nicotine patches, which deliver medication continuously over time right through the skin. And a quick tip here, patients absolutely must rotate those application sites to avoid skin irritation. Now, let's see how all this builds into another critical safety check.
All right, here is your second golden rule, and you absolutely need to memorize this. Ophthalmic means for the eyes, and otic means for the ears. Ophthalmic drops must be perfectly sterile because the human eye is incredibly sensitive to infection. Otic drops, the ones for the ears, they don't require that same strict level of sterility. Because of this difference, while sterile eye drops can technically be used safely in the ear, non-sterile eardrops can never, under any circumstances whatsoever, be used in the eye. Mixing this up is a massive safety violation.
Next up, Section 4, bypassing first-pass metabolism. This is for when speed and maximum absorption are absolutely critical.
To understand why some routes are chosen over others, we really have to grasp this concept. When a patient swallows a pill orally, it goes right into the gastrointestinal tract and faces something called first-pass metabolism. Honestly, think of the liver as a super strict bouncer standing at the door of the systemic bloodstream. It heavily processes, filters, and digests the medication before it ever gets to the rest of the body. This bouncer inherently slows down the onset of the medication's effect and heavily reduces the amount of active drug that actually makes it into the patient's system.
So the million-dollar question is, how do we sneak past that bouncer? Well, we have specific routes designed to entirely dodge that digestive roadblock. First is sublingual, or SL. This is where a tablet is placed right under the tongue. A classic example here is nitroglycerin. If someone is having a heart attack, they do not have 45 minutes to wait for their stomach to digest a pill, right? It goes straight under the tongue for rapid relief, absorbing directly through that mucosal lining. Second is intravenous, or IV, which is an injection straight into the bloodstream. IV provides the absolute fastest onset of action, which is exactly why it's the go-to in emergency or hospital settings. The big takeaway? Both SL and IV routes completely bypass the GI tract and first-pass metabolism for an immediate systemic effect. Finally, we've reached section 5, the when. It's time to decode prescription frequencies and figure out the timing of medication doses.
You've got to memorize these standard frequency indicators to prevent over- or underdosing. These are your SIG codes, and they actually come from Latin, which kind of makes them a bit more fun to decode. BID is bis in D, meaning twice a day. TID is ter in D, 3 times a day. QID is quarter in day, 4 times daily. And QHS means quaca hora somni, or every night at bedtime. Accurately distinguishing between these, for example, making sure you don't confuse a twice-daily instruction with an at-bedtime instruction, is a core part of what you'll do as a pharmacy technician to ensure the patient takes their meds at the exact right intervals.
But watch out, because some abbreviations are so dangerous they're literally banned. The Institute for Safe Medication Practices, or ISMP, publishes a strict do not use list. Take QD for every day and QOD for every other day. Imagine those scribbled in messy doctor handwriting. They look incredibly similar, don't they? They're flagged as highly dangerous because they are so easily misread, leading to severe dosing errors. U for units? That can easily be mistaken for a 0. Always spell these out in plain language on the patient's label to ensure total clarity.
All right, let's put your new muscle memory to the test to wrap up our explainer today. Let's look at a mini scenario straight from a real-world prescription. If you see the SIG code 1-tab PO-TIDAC, how would you translate that for the patient's label? Take a few seconds and try to piece it together based on everything we've just covered.
So, did you get it right? The correct answer is, take 1 tablet by mouth 3 times a day before meals. Understanding that PO means by mouth, TID means 3 times a day, and AC means before meals is the absolute key here. Recognizing these combinations ensures accurate, safe patient care every single day in the pharmacy. Remember, every single abbreviation you decode correctly is a potential error you just prevented. So as you finish your review today, ask yourself, what other hidden medical languages are you going to have to decode to save a patient's life? Keep studying, keep practicing, and I will see you in the next explainer.